Okay, great. And just to let anybody know, the YouTube connection is about 20 seconds behind the live meeting, but everything that should be said from here on out will be streamed over YouTube. So Deb, if you want to go ahead and begin anytime you're ready.
Okay, thank you. Thank you, David. Good morning, everyone.
Morning.
I am Deb Stidham, chairperson of the board for the Kansas Behavioral Sciences Regulatory Board. I ask that the members of the board to respond to a roll call to signify their presence at this open meeting that is being conducted remotely. David Anderson.
Present.
Danielle Johnson. Mary Jones.
Here.
Jacqueline Lightcap.
Here.
Jonna Norton.
Here.
Bruce Nystrom.
Here.
Andrea Perdomo Morales.
Here.
Leslie C. Wester.
Here.
Laura Shaughnessy.
Here.
Rick Steele.
Here.
Present.
Carolyn Zaspran.
Here.
So I also note that the staff members are present. David Fye.
Here.
Leslie Allen.
Here.
Assistant Attorney General Jan Arndt. Rainey Bernard and Jane Weiler. Are they all here?
Laney's here.
Jan.
I think Jane had a conflict, so she probably won't be joining us.
Okay. So these are the board's legal counsel are also present. So next, David Fye, Executive Director for the agency, will read a message concerning this meeting being held remotely.
Thank you, Deb. I just wanted to let you know Danielle Johnson also just went ahead and entered the meeting as well. So,
Okay, great.
my name is Dave Fye. I'm the Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the board about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the board to provide public comment or answer questions from individuals. In the public meeting notice concerning the board meeting, it was indicated that members of the public should contact the Executive Director for the agency by email by noon on Friday, January 8th, if they wish to provide public comment at this meeting. However, no request for public comment was received. As such, there will be no public comment at the meeting. Because we are conducting this meeting remotely by conference call and other teleconference ability, I state for the record the following information. Because the emergency declaration that was issued for the COVID-19 pandemic has been extended to January 26, 2021, the meeting is being conducted remotely to comply with health and safety concerns, as the board's conference room cannot accommodate social distancing for everyone in attendance. However, access to the meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the agency's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended. As such, we'll be conducting the meeting pursuant to the KOMA, as well as Kansas Administrative Regulations 16-20-1 concerning compliance with the KOMA during the existing emergency disaster declaration. On January 6, 2021, we sent notice of the board's meeting to all individuals who requested notice of the board meeting. The notice and agenda were posted on the board's website at ksbsrb.ks.gov. You may obtain a copy of the notice at that website, and you may also request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line, quote, request for the agenda, and it will be sent to you. The notice contains information for the conference call and the YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board's office at 785-296-3240. Any member of the board staff or presenter shall state the person's name and title each time the person speaks or votes. Each participant of this meeting shall ensure microphones, phones, or other electronic devices are on mute when the participant is not speaking. Each motion will be clearly stated before the board vote, and each board member will vote when their name is called. The chairperson will announce the result of the final vote. A statement or motion will clearly identify each member of the board or staff who the board delegates the authority to sign any binding document on behalf of the board. A recording of the meeting will be posted on the board's website, and the board has the following items listed on the agenda: opening remarks by the board's chair, agenda approval, approval of minutes from November 9th, 2020 and December 21st, 2020 meetings, public comments, executive director's report, staff reports, complaint review committee reports, professions reports, old business, new business, and adjournment. The board's agenda does not include an executive session. However, if the situation arises where the board elects to go into executive session, the board will follow this process. First, the board must be in an open meeting before going into an executive session. Then a board member must make a motion to recess for an executive session that is seconded by another board member. Each board member will then vote. A majority of the board must vote in favor of the motion to exercise this executive session. The chair will announce the results of the vote. The motion must contain a statement of justification for closure and the subject to be discussed pursuant to KSA 7543-4319B and the time and place the open meeting will resume. If a motion for executive session passes, the conference call will be placed on hold. Attendees may stay on the call or return to the conference call number at the expiration of the executive session to attend the remainder of the meeting. The public will be excluded from the executive session portion of the meeting as the executive session will be conducted by electronic means that are not available to the public. When the board members return to the conference call, the open meeting will resume through the conference call. The complete motion for an executive session will be recorded in the minutes.
Thank you, David. So the meeting is now called to order and the board will begin its discussion of the first item on the agenda, which is agenda approval. So I would like to amend the agenda by basically deleting number 3, minutes approved for November 9th. We've already done that. And December 21st, as they are not quite finished and ready for approval. Did I get that right, Leslie and David?
Yes.
Okay,
That's correct.
so otherwise, I do not believe I have any changes to the agenda unless anyone else has any. Okay, hearing none, I would entertain a motion to approve the agenda as amended.
This
is
is
the
Danielle
interactive-
Johnson. I move to approve the agenda as amended.
Is there a second?
I
is-
second that.
Okay, all in favor, say aye.
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 Any opposed? All right, thank you. Now if I can get the iPad to work, I will go to the next item. Does anybody else have trouble with their iPad like I do?
I have, this is Carolyn.
I would say it's our age, Carolyn. But, okay. We don't have public comments as none were requested for today. And so the very next item is Executive Director's Report. David.
Thank you, Madam Chair. So I wanted to go ahead and brief the agency on a few things that have been going on around the office, and it has been pretty busy here lately. First, in terms of agency updates, Max Foster's retirement. After almost 8 years of service, Max Foster retired from state service this past Friday. And despite the pandemic, we were able to do a small, nice goodbye to him and wish him well. Over the last few weeks, Max has been a tremendous help in transitioning, helping me transition to the new position. This week, I will be identifying any remaining items that need to be moved over. Some of the technical items include subscriptions or different things that IT needs to transfer over. So some of those might be going on at the beginning of this week and throughout this week. But big help to Max and wish him well in his retirement. The second item is, as I mentioned earlier, Behavioral Sciences Regulatory Board now has a YouTube channel. And the YouTube channel is essentially due to, there was an advisory committee meeting on December 18th, which was unfortunately Zoom bombed. And after that, I wanted to go ahead and find a more secure way to hold meetings. So I spent some time researching other options about what other entities are doing, including the legislature, the governor's office, the district court, other agencies that are similar to the BSRB. Went ahead and went through the steps to set up a YouTube channel and get it verified. And so that's what we are using today. This was kind of set up at a bit of a lightning pace. So I do expect that probably will be a few more adjustments as we go forward. But I'm proud of the work that the staff did in assisting me in turning the YouTube channel into something that we can go ahead and use. And the hope is that we can use that for the board meetings as well as the advisory committee meetings as well. The next item, follow-up from the board meeting on December 21st, 2020. So I know the board will be discussing some of the language in regards to the temporary permits. I just wanted to give you all an update. At the last board meeting, there was a discussion and the agency asked for the board's direction in terms of individuals who are currently practicing under a temporary permit. And the board had advised the agency to go ahead and contact those people and let them know that if they wanted to continue to practice with a temporary permit in the following year, 2021, that they should submit a new request for a temporary permit and pay the fee that's in December 31st, 2020. So basically for the start of the year. And the board, the agency did receive several of these new requests for temporary permits. It was also stated at the last meeting that while somebody is in the process of having their application reviewed, they will continue to be able to practice Some of the individuals who had been under a temporary permit went ahead and have been walking through the steps to have a more permanent license in Kansas. So I just wanted to give you an update at some of the response that the agency had been receiving since that direction from the board. Next, in terms of operations updates, in one of my roles, I've been going through some of the office policies on different things and getting to know the staff a bit better. I wanted to let you know that sort of on a low level, I do plan to do yearly evaluations of staff. And so I've gone through the last few weeks and started to have those meetings with the staff in terms of my expectations for them, and then looking at some of their thoughts in terms of goals going forward. Additionally, I intend to do sort of a comprehensive review of the staff policies and try to get an updated office manual for the agency here. Also looking at office policies specifically related to employees working under the pandemic restrictions right now. We are trying to balance a number of factors in terms of staff safety, but also making sure that we continue operations in an efficient way. So I was hoping to look at trying to get a few more staff members in the office on a day-to-day basis, but the numbers in Shawnee County have unfortunately gone up after they had gotten to a little bit better level. So I just want you to know I'll be watching that and trying to reevaluate how we're going to be doing the staff in the office while trying to balance the factors I mentioned, such as staff safety and efficiency and different factors. To that end, the next item, evaluation of current computer equipment and processes. So when the pandemic happened, we went to a lot of staff members working from home, and we've kind of gone to a blend of that since then. Some of the computers in the office are a bit aged, and there have been some issues. So I've been meeting with representatives from the Office of Information Technology Service in terms of looking at, is there something we can do in terms of replacing or looking to replace some of the computers in the office. There is sort of a phase-in approach that is discussed in the budget, but I was looking at a couple different options, and I'm collecting some information at some meetings here recently, and I'll be looking at some options going forward. So I want to give you guys an update on that. Also, in terms of looking at current phone equipment, so the office does receive a lot of phone calls from members of the public and emails, but specifically for phone calls, we're in a bit of an interesting position because the staff members should not be providing their personal cell phone by calling people while they're working from home. But we currently don't really have a great way for the staff members to communicate with people from the public while they're at home. So I'm working at some different ways that maybe we can use some technology, or maybe we can have a way to use some of the office technology in a more productive way at home to allow some better customer service. So I just want to let you know I'm going to be looking at that and looking for different ways that we can make improvements in that direction. In terms of the next item, in terms of legislative items, I wanted to give you guys some key dates and walk through just at a high level some of the different things that will be coming up from a legislative perspective. The legislative session is beginning, and so the governor's budget report is expected to be delivered to a joint meeting of the House Appropriations Committee and SWAM. And I believe that is tentatively scheduled for Wednesday of this week. Basically, what happens is you have the state of the state by the governor's office, where the governor does a presentation, usually to both chambers in a combined meeting. This will be a little different because of spacing issues in the pandemic, but essentially the governor will talk at a high level about her goals and any big changes she would like to make. And then usually the following morning at a joint meeting of HAP and SWAM, House Appropriations Committee and Senate Ways and Means, she goes into, or someone on her behalf from the Division of the Budget goes into more of a plan level and describes some of the big items the governor is recommending in terms of either adjusting expenditures or adjusting revenue. So I think that morning on Wednesday, that will be a meeting that we'll be paying attention to see what information, if any, the governor has made in terms of recommendations for the agency's budget, since it was reviewed by the Division of Budget back in the fall. In terms of other important notes, February 1st is the last day for legislative members to request bill drafts, and February 8th is the last day for non-exempt committees to request bill drafts. Essentially, the way that the bills are introduced for the legislature is bills can be introduced individually by members of the legislature, and a handful of those have been done so far. But the way that most bills are introduced is you have a member of a legislative committee that will request a bill draft in an actual committee meeting. They will start the meeting and ask for any bill introductions, and then either the member of the legislature will speak to a bill draft, or they will call upon somebody to come to the podium and ask for a bill draft. And so those February 1st and February 8th days are important. Additionally, I mentioned that that's the last day for non-exempt committees. There are certain committees that do not have a deadline in terms of bill introductions. That is House Appropriations, Senate Ways and Means, and a handful of others. And so during the legislative session, they are able to request bill drafts the entire way through. So I just wanted to put those dates on your mind. Additionally, for later in session, the first adjournment is scheduled for Friday, April 9th. During that time, the legislature usually leaves for about 3 weeks, and then they come back for a veto session, or called omnibus, and that happens at the start of May. So those are the tentative dates. Now they're all subject to change, and it could be increased or reduced. In terms of committee news, I wanted to let you all know that on the House side, Representative Brenda Landwehr will be returning as the chair of House Health and Human Services. The Higher Education Budget Committee is usually the budget committee that reviews the agency's budget, and that is chaired by Representative Susan Humphreys. And Representative Troy Waymaster will be returning as the chair of House Appropriations. On the Senate side, Senator Richard Hildebrandt will be the chair of Senate Public Health and Welfare, and Senator Billinger will be the chair of Senate Ways and Means Committee. In terms of the budget process, I spoke to the GBR would be presented later on this week. When that is presented, there will be that presentation, but also I'll be able to access the system. It's called IBARS, and that will allow me to see sort of on a data level any monetary adjustments to the agency's budget. In terms of the bill hearing process, as I mentioned, the Revisor of Statutes Office drafts bills for members of the legislature. What we have done so far is based on the board's previous discussions, we have met with members of the Revisor's Office for essentially conceptual bill draft purposes. The revisors cannot draft a bill unless they have a member of the legislature that basically permits them to work with another entity. So we've had discussions, but to have a permanent or a formal bill drafted, we would need to reach out to a member of the legislature. So the plan is, after the board meeting today, take the information that you have settled upon today and then go ahead and reach out to a member of the legislature. And that member of the legislature, we would ask permission from them to contact the Revisor's Office to officially have the conceptual content drafted into a bill. And then when the committees start meeting, we could ask that member of the legislature to officially, formally request the bill be introduced. And when that happens, the bill draft is essentially sent to the chamber, and then the chamber assigns a bill number to it and sends it to a committee. In this case, most likely the committee that would receive it would be Health and Human Services, but it could be assigned to any chamber. That's based on leadership's preference. The other couple things I wanted to let you guys know just briefly is that bills can be pre-filed during this time. And so I've been trying to watch for some of those pre-filed bills. As I mentioned, those can be sponsored by members of the legislature. There are 13 Senate pre-filed bills, 47 House pre-filed bills. One bill in particular I wanted to put on your radar is Senate Bill number 10, and that's one that I'll be watching. In its introductory language, it titles itself as the Right to Earn a Living Act. And without summarizing the bill too greatly, essentially what this bill would call for is that any agency with occupational rules and regulations would need to do a comprehensive review of all of its rules and regulations and statutes and regulations, and essentially justify whether each of these rules and regulations satisfies a health, safety, or public welfare objective. And any that do not, the agency would need to make adjustments going forward. So this bill has just been introduced. It's the start of the biennium, so all the bills are new, but I will keep an eye on that bill. Should that bill ultimately pass, we would need to do a comprehensive of all of the rules and regulations that we currently have to see if they meet those qualifications. So I wanted to let you know that I'm keeping an eye on that bill, and I'll let you know if that bill comes to the point to where it is going to be passed, or it does pass. So, and that concludes my report.
Thank you, David. I have a question for you, Step Stidham. What is the plan then for reintroducing the bill? And of course, we've got additions that we introduced last year, since we have to start over.
Yeah, Deb, and so based on the previous discussions of the board, it was my impression that the board had basically said they wanted to go ahead and use the bill from last session, the 2603, as sort of the base for this year's bill, to include those items and then add any additional adjustments. And the revisor who worked on that bill would be the same revisor that we'd be working with going forward. So the language would basically just be put into a new bill And there's some choices here, but without further direction, I would ask the revisers to go ahead and put it all into one bill. If you'd like me to break it up, I can ask them to put it into several bills. But essentially that would be the base. It would be the base of the language from 2603 with some adjustments to reflect different years and things like that. And then any other adjustments to other statutes, that would be what the board had decided.
Do we have any idea who would be willing to introduce this bill? What legislator?
So I have not spoken with any members of the legislature. I believe what was likely to happen is that they would ask me a lot of questions about what the board wanted to do. And since the board was going to be meeting today, I decided I would wait till the board had a final position and then reach out. Representative Brenda Landwehr had chaired the Mental Health Modernization and Reform Committee. So if the board has no objection, I know that she's looked at a number of the topics that have to do with some of these mental health topics. And so my plan would be to reach out to her, but I could also reach out to other members of the legislature. But if you'd like me to contact anyone specifically, I'd be happy to do that. I had worked with her in the past, and so that was the person that I had in mind. But then again, it could be any member of the legislature who could request the bill be drafted.
Very good. Any other questions for David from the board? Okay. Next up is staff reports. Are there any staff reports?
No.
Okay, thank you. Next up is complaint review committee report. Is that you, Bruce? You're on mute, Bruce. There he is.
Of that.
That's good.
Okay. Does everyone have hard copies of the cases that we've reviewed recently?
Yes, they're in the iPad.
Okay. I have to ask because my iPad blew up some time ago, and I get these separately. So we have the first one is cases reviewed. One thing that when I look at this that I'm really happy about is that the number of cases we looked at for December fell off quite a bit. We weren't quite as busy. We didn't have as many cases to look at. We had 2 consent agreements or summary proceeding orders. We had 4 diversions, 3 public censures. Out of all the ones that were submitted, 16, we said that the facts presented did not support the allegation. 2 of them were not docketed. We sent out 2 cautionary letters, and we have 1 for further investigation. We needed some more information on that one. On the next page, it shows, again, some of the summary numbers for December 2020. We received 16 cases, we closed 35, and for a total of 88 cases. And then on the next page, RAV statistics for fiscal year 2021. This breaks it down by profession. The first box you see is cases opened by license. Like the very top one is licensed psychologists. We have 8 open cases, which represents 0.9% of all the cases. And then it goes down through all the different categories. And then the next box down indicates the number of cases received. So the first one is cases open, the next one is cases received. And I think if you look at this, if we had all the prior months and years, this is fairly average. I don't think there's any huge difference in what's going on here. So that's about it. People are doing well and not, they're either not getting in trouble or they're not getting caught. I hope it's that they're not getting in trouble. Any questions? Hearing none, that's my report. Thank you.
Yeah. All right, professions reports, psychology. I'm not sure how many of these we're going to have in hindsight, because we met in December.
Yeah, none from psychology.
Social work?
We have not met in between. No reports other than what's on the agenda later on.
Professional counseling?
Yes, we have not met since the last board meeting, so we have nothing new to report. Thank you.
Master's level psychology?
We too have not met.
I'm really disappointed in this board not meeting over the holidays. I don't really understand what that's about. Like maybe no one would attend your meeting, or?
We're slackers, Deb. We're just slackers.
Marriage and family therapy?
We also did not meet since the last board meeting.
Addiction counseling did not meet, and I presume behavioral analysis has no report. Is that right? Okay. I think we are ready for old business. As soon as I find my agenda again. There it is. Temporary permit statutory language changes. So this is in your packet. We discussed this at length last meeting. Some of the changes that we think may need to be made statutorily to our temporary permit language so that it is more clear, particularly since we've had such an influx of applicants for that since COVID.
And Deb, would you like me to briefly summarize the 5 adjustments that the board talked about the last meeting?
You're earning your keep already, David. Absolutely.
Well, thank you. I've been working with Leslie on this. And so as I mentioned, the revisor's office really is an attorney for the members of the legislature. So in terms of any official draft that they might do, this is probably going to look a little bit different, but I took my best stab at go ahead and modifying it based on what the board had discussed at the last meeting. But essentially you have 2 documents, and the first document, really the first page, is just an example of the temporary out-of-state permit language. I use professional counselors. So the first document really doesn't have any changes. It's just the language that currently exists in the statutes. The second one that is the markup, it has a header example statute on temporary out-of-state permits, professional counselor with board adjustments. That's the second page. So essentially there were 5 things that I tried to incorporate in some draft adjustments here. The first was to change the length of time for the temporary permit in terms of being able to practice in state, the number of those days. There was discussion to go ahead and change that from 15 days to 30 days. The second is that under the existing statutory language, these temporary permits would end on December 31st for the year in which they were approved. And that essentially would be changed to ending 1 year after they were approved, so 12 months after they were approved. The third had to do with some language that would be added to the statute that would note that in terms of who could apply for these temporary permits, it would say persons applying must have practiced in their state for at least 2 years before requesting permit. And the cleaned up language we used was that we added a section that says, and has practiced in that jurisdiction at least 2 years immediately preceding the date of application for a temporary permit. The fourth was that there was discussion to go ahead and require reports. And those reports were mentioned in terms of how many days the individual was practicing or how many in-state days of practice the person had while they had the temporary permit. I would be looking for a little bit of clarity from the board in terms of some of the specifics on those reports, but what I put in was essentially at the end of section A, where it says days per year upon receipt of a temporary permit to practice issued by the board. And then the language that I added was with quarterly reports to the board on total days practiced in Kansas. There were some options here: annual reports, monthly reports, quarterly reports. I put in quarterly reports as a placeholder, but I am certainly open to any other direction from the board in terms of changing that language or doing something a little bit different. And then the last item the board discussed was in terms of an extension or a new temporary permit. And essentially what I did is in the section C, I went ahead and modified it. There was also discussion that the temporary permits would be approved under emergency circumstances as defined by the board. So it says upon written application, and I added the language emergency circumstances as defined by the board, struck for good cause. And at the end of that, the board may extend the temporary permit to practice. That previously had talked about 15 days in terms of an extension, but I changed that to make it a little bit clearer that the extension of the temporary permit, if approved by the board under emergency circumstances, would be for another 12-month time period. And I could go ahead and make another note in here to clarify that if someone did receive an extension for another 12-month time period, that would entitle them to an additional 30 days for that specific time period. I didn't put that in here, but I would be certainly happy to put that in here to clarify that. I just did not put it in this draft for the board's consideration. So wanted to go ahead and walk through those 5 items and kind of show where I put that in the draft language, but I'm certainly open to adjust anything more. The board actually voted on these items at the last meeting, but some of the items were broadly discussed. So I took a stab at it, but you are more than welcome to let me know if you'd like me to make any further changes or clarify anything else.
David, if I can make a comment.
Oh, sure.
Okay. One thing about the quarterly reports, what I would suggest adding is like what you have in your applications as a quarterly report approved by the board, so that you basically develop the form so that you get all the information that you want from those, so that consequently you don't have 100 reports that all look different. You want them all the same. So something about that's been approved by the board, or they have to get the report from the board.
On a form supplied by, yeah.
There's language in our other statutes about that they have to use a specific form. And then the other thing on extensions, because what's kind of happened with here, they come in at the last minute wanting this extension. So maybe say that 30 days prior to expiration, they have to put in their application if they want it extended. That might help, I think, so that you don't get these last minute stuff. And I think if you look at your language in your applications, renewal application statutes, I think there might be something in there that they have about when they need to start putting in their renewals or their extensions. Those would be my 2 comments. I think that could kind of give some more clarity to this.
Other comments from the board?
I like those changes as well. And I agree, David, I think adding the clarification after the 12-month time period, which entitles them to a 30-day, would be a nice clarification as well.
Thank you. Anyone else? Questions, additions? Are we ready for a motion to approve as written with that change? With Jan's addition and Mary's addition?
This is Rick. So moved.
I'll second. It's Leslie.
All in favor, say aye.
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 Any opposed? All right, good work, everyone. Good work, David. Appreciate your hard work on that. Okay, back to the agenda. Next item, board approved clinical supervisor for social work to add to the 2021 legislation. This is also in your packet. Does Carolyn or Andrea want to talk us through this?
When we met in our advisory meeting on the 12th, December the 8th, excuse me, we all advisory meeting members supported mandated supervisor training. We discussed that training process being 6 to 8 hours, but Andrea and I forgot to add that last board meeting to this legislative session, as we'd like that to be considered. We selected a one-day workshop versus more because we also have the LSW training manual now posted on the board. So we figured with those two, it would be a nice place to begin.
So just for my clarification, Carolyn, is that like 6-hour training, 8-hour training? And I realize that's not in the statute, but I'm just curious.
I think that we were leaning towards 8 hours. Some members felt that 6 was not quite enough, so we increased it to 8. Is that correct, Andrea?
Yes, that is correct in that conversation.
I have a question. So prior to that going into effect, would there then be an approved training established, and if so, by whom?
I think those are the logistics that we would have to work through. Currently, if this goes through, we would be potentially looking at this not taking effect until March or so of 2022. So we still have some time to fully execute a plan and what those requirements would look like.
So the regulations, would have to be promulgated that would spell out the hours, the content.
Mm-hmm.
Do you guys have a sense of that outline of the content that you were thinking about?
Currently, we would need to look at what the standard practices are across just nationally. And so those are resources that I'm gathering right now so that we can talk about those at the Social Work Advisory Committee meeting.
And we will be meeting here soon, actually the 26th, I believe, of this month.
I know we have several new board members since the last statute change that created the training for the MFT and LPCs. I don't even recall some of the behind the scenes, how that became to be that certain agencies or schools or whoever decided to offer that. So I don't know if Leslie or anyone has any kind of backstory as to how that came about last time. Did we just have, it's kind of like free enterprise? Somebody says, hey, I think I want to put that together and offer it for the state. And then they get it then approved by the board that yes, this thereby meets the requirements. Is that?
Yeah. We have had a couple from other professions that submitted the training and had it approved by BSRB so they could say, this meets the requirements. But there's a large portion that just there's all kinds of trainings from SAMHSA and NASW, all different places that have these kinds of trainings that people can take them.
I asked the question in part because we've had a staff member and we've talked with Mary about this, LCMFT, and finding a training that met those requirements has turned out to be kind of difficult. And the national training is almost $1,000, and it's 30 hours. So it's quite a, that's a lot for somebody to do.
Our
Dave?
SWB, our National Social Work Regulatory Board, has many options. They're very, very cheap, actually, very inexpensive and available. The whole idea is to try to make it affordable and, easily accessible for people that are wanting to become, supervisors. So I think there's a lot of options in our profession.
Dave, one thing I was going to say was some people, when they submit their training, not all from one training, because not every training will have every point that BSRB has.
Right.
Well, and I have a question. Is it correct that on 3C currently, it's a requirement for 3 hours of the continuing ed and then including ethics and supervision? So are we changing that? Is that, or does that overlap? So I'm just curious.
It overlaps. So it could be part of the ethics too. Is that what you mean?
Yeah, so I'm wondering, so 3C, so there's a clinical supervisor needs to complete 3 hours and then 1 hour of ethics. So is the social work committee wanting to just add that in as an 8-hour training and remove the 3 hours, or are we leaving the 3 hours and then just accepting that other training?
Leslie, I think that's a good question. Under 3B, it does say that the supervisor has completed the minimum number of continuing education hours related to the enhancement of supervision skills approved by the board. So I think we do need to distinguish the difference between B and C. I read C as continuing education versus the initial CEUs that you would have to take to become a supervisor.
Thank you. That makes sense. Yeah.
C is for renewing.
Okay.
Because it's referring to the renewal statute, I believe, in 656313. So the 3 hours ethics is part of the renewal.
So
Thank you.
Part of my concern kind of relates to what Leslie said, is that if people can just kind of pick and choose trainings from all over the place to pull together, what essentially do we think that if what we're saying is they need specific training in order to be a supervisor, but it doesn't sound like we have a prescribed training, then I'm a little confused about that.
Right, because we can't make the training. We can't develop the training or offer it. So it would have to be someone else.
Now, could the committee, or I'm sorry, could the advisory committee, could they do that?
Jan.
Well, the advisory committee can't make any kind of final decision, so they can make recommendations for the board. But pardon me, go ahead.
I thought they were asking if the advisory committee could make a course.
No, that's not what the board's authority is to do continuing education. I had a question under B3A. You have about semester hours of coursework related to supervision skills. So if everyone already has a degree and then they, would that require them to go back to a college or university to get semester hours? And then you also don't have or equivalent in case there's someplace where it's quarters or something, you would need to add that.
The idea is that some colleges and universities offer that, Jan. So if you happen to have gotten it, then you're good.
Mhm.
Or
Yeah, that's right. I'm curious, are we telling them to do something that college and universities don't offer? I mean, do college and universities have coursework in supervision?
It's my concern that we're kind of creating a process without a training in place and then hoping somebody does an adequate training that would meet the standard. It seems a little out of order to me.
Or I think under 3A, it says or, so there's a choice between 3A or B.
I was just curious though, I mean, to put something in a regulation when it doesn't exist, could kind of be misleading. But again, if we're going to keep that in after semester hours, you need to add that language like what you have in your other statutes, like for your education, which is or equivalent. I can't remember the exact language, or equivalent, so that if they go someplace where they have quarter hours, that you could convert it into semester hours.
Okay.
we're several years since we've passed the similar legislation for the other two disciplines. Does anyone know if any of the schools that routinely train these folks in professional counseling or marriage and family therapy have started to incorporate that into their curriculums?
I wouldn't say into the curriculum, but I know Friends University does an annual supervisory training, and some elements of that would be hours counted towards the topics that would qualify towards your refreshing or your initial hours. And I mean, there is a way, if you look at PESI or NetCE, or there's a lot of platforms that provide courses on supervision and how to provide supervision. So, MFT, when the advisory committee worked to come up with what the board approved supervision would look like, we obviously took cues from our national organization. And you wouldn't have to complete the full certification at the national level. Part of their training would qualify you to be a board approved supervisor in Kansas. So we'd kind of done research. I was part of that work group a couple of years ago when we were coming up with what that might look like.
That is what I was suggesting with the advisory board for social work, that they would do similar to what Mary was saying, just have some of the options, I guess, that the board could approve for that supervision.
Mm-hmm.
And recently it didn't appear like the national organization for MFTs was offering the kind of amount of hours that would have met the Kansas criteria, but only offering their full package, which is 30 hours. So that has changed and created a kind of an additional burden for people, I think.
Just kind of my own observation working in a large mental health center. I'm not sure how well we've communicated these new requirements. I think that's been a slow trickle out for people to understand that this came. And then really the bigger challenge is, how do we direct people where they can get this and how they can, maybe we need an FAQ document developed. I'm kind of agreeing with David that this may be kind of clunky to put together regardless, just because of how we operate under statutes and regs. Seemingly putting the cart before the horse in some ways. But all that being as it may, I think we just have a duty to let our licensees know how to get this training and how to meet that. All this time, I thought there was just a few that were approved. I did not know that you could piecemeal it, get an hour here from this place, an hour there. That's never been said in front of me before, or I wasn't paying attention. So, so that's my caveat to this whole thing. I do what, it's a tough situation. We need the training. It seems like a lot of people who are frustrated with the fact that it's hard to know where to go get it agree that probably it's a good thing. Somehow we've got to balance this out by getting more timely information to people.
And Deb, I'm sorry to interrupt. Are you referring to the MFT current?
Either one. I mean, I don't have that many marriage and family therapists at Johnson County Mental Health, so I haven't experienced exactly what David has, but I know the training for the LPCs just came up recently, and it just leads to a lot of questions. And I think the cost is an issue in today's environment. Fortunately, the agency here is willing to pay for that for someone who's willing to supervise, because that's a value that we have here is supervising students. And so, but I don't know that other places will do that. So it's just, we're not in a perfect world, so we'll just continue to do the best we can.
Yeah, and I would, add again that the NSWB and national and state both, and as well as ASWB, they offer many options and affordable options, for social workers to attend. And that's in addition to other organizations and businesses that provide CEU trainings.
But I think it would be good to take some of the lessons learned from the professional counselors and MFTs, and we can incorporate that into our social work advisory committee meetings. And thankfully, we do have some time, if this is passed, to really be ready for when this is a requirement for those that are seeking this level of supervision.
So I guess going back to Jan's comments about some additions or whatever to the language that's proposed here, relating to quarter hours, if that is in fact something that the university offers as opposed to semester hours. Were there other changes that folks were proposing? I know there was discussion about B and C, but I think we've hopefully cleared that up, what those were pertaining to.
Is there a fee? It was my understanding that there hadn't been a BSRB fee for that.
No, we have not charged to be a board-approved supervisor. We haven't charged any other professions either.
And so is under B where it says accompanied by the fee.
Oh, it does say that. Yeah. It may have never made it into regulation.
Yeah, I think it was purposeful that we didn't charge.
Maybe we should strike that.
Yeah.
Good.
Could be a nominal fee. It wouldn't have to be like your application and licensure fees. Just something to help cover the cost of processing all of this.
There will be a lot more social workers than the other two.
A whole lot more.
I hadn't considered that.
Well, I think that the issue that I would have is charging now when we haven't been. And again, that would be somewhat confusing.
Well, you couldn't do it anyway until you did the regulation to assess the fee. And, that would be months away. So it would give the time then to kind of put people on notice, hey, when you renew next time, you're probably going to have to look at paying a fee. And like I said, hopefully, I mean, you could keep it nominal. You wouldn't.
It wouldn't be a renewal. It's just a one-time approval.
I'm looking to see if the other ones have it in the fee statute. I don't think they do.
Mary, you had mentioned that, I think you used the word refresher. Are there requirements for MFTs to reapply?
Not with the BSRB. Once you've approved, you're approved. Double AMFT has requirements for continuing ed to maintain that certification.
This does have 3 hours of continuing education. It's there.
But we don't have to renew our
No,
application.
right, it's just with your renewal, yeah.
One other thing about the fee, because you have the fee fixed under KSA 655808, you're going to have to go in and amend 65808 to include a fee for supervision approval, because that's probably not in there right now in all the list of the fees. So you're going to have to do another amendment to that statute as well.
If we decide to create a fee.
Well, you're either going to have to strike that language or to go into 655808 and add a supervisor fee. Because you have to go into that fee because that's where they set the maximum amounts that you can charge for all your different fees. And so consequently, if it's not in there, then you don't have anything to work with. So all you're doing is that statute doesn't say what the fee is. It just says it's a maximum that you can charge. And then you go in your regulation, and then that's what you decide you're going to charge up to that maximum. So that's the other piece of the puzzle is 655808.
This is Dave. I did a quick review of the statute, and I don't see any kind of fee for supervisory functions under that statute. So
yeah, because they don't have a statute for that it won't be in there. I mean, yeah. So if you're going to have a fee, then you have that other statute to amend as well.
Right.
It's the same thing.
So would we be able just to strike that part if the other professions don't have that in theirs?
I would suggest that you go back and look at the statutes for the other professions to see if it is in there.
It is.
Then you may want to keep it. I mean, and then if you're going to charge it a fee of any kind, even if it's for $1, then you're going to have to go into your fee statutes, like what we did, this 655808, make sure that it's been added in there before you can even begin to assess any kind of fee in a regulation.
So Jan, the
problem is if you strike that now and then you get 1,000 of these applications and this is becoming very costly, you've got to go back and do a statutory change then to start to collect the fee to do this. So you kind of need to make that decision now, or at least before you submit it over to the legislature for a review, for approval.
Can we say it may be charged?
Well, that the maximum.
But then we'd have to charge something.
That's what it says.
Well, it says shall be accompanied by a fee fixed under. Okay. So that means the shall means that there should be a fee, but you could change it to like what Leslie says. And I'd have to look at the language. And it's usually like the board may assess a fee as prescribed under that. So you could change it to may, and then that gives you discretion on whether or not to charge a fee.
Because the other two professions, it's in their board approved statute, but it's not in their fee statutes either.
Again, someone didn't catch that. You needed to go in and
right.
So if you're going to make everything, because that's what you're trying to do is get uniformity kind of across your acts. So that would be something that probably you need to do maybe in this packet that you have now would be go into the fee statutes to add that in there so that if there comes a time that you need to start charging a fee, you can do that. But yeah.
Okay.
Well, I hear you saying if we add that and that we need to start charging the fee as soon as it's.
Well, you can't charge your fee till you do your regulation to say how much it is. So once you get your fee statute in there and that's effective, then you do your regulation. But like I said, all the statute does is to assess a maximum. And you could, so consequently, you could do $1 and that would suffice. If you want to have discretion on a fee, if all those other acts say shall be accompanied, you would have to go in and change those statutes to say the board may prescribe a fee.
Okay.
If you want to make it everything discretionary, you're going to have to tweak the language in your supervision statute. And then you're also going to go in your fee statute and to put in a fee for a supervision approval. And then you'll do the regulations to decide how much it's going to be.
I don't really recommend opening the other statutes for just this purpose. So it sounds like we're, due to precedence, we're moving in the direction of keeping the shall, going into the other statute and creating an amount we can live with, and then a reg amount we can live with.
But then social will charge and none of the others will?
No, once the fee statute's been changed, we'll have to start charging for all of them.
Right, but we'll have to go into the other fee statutes. It's not in the statutes either. That's why I was confused.
If you don't have it in your other professions, you'll have to change those statutes to start charging to get a maximum amount.
But we wouldn't be opening the board approved supervision training statute, just the fee statute.
Just the fee statute. Yes, that's correct.
Okay, so leave it and leave it. Shall.
Everybody follow all that?
So we're leaving it and we're leaving it shall and putting it in the fee statutes of all three.
Yep.
Okay.
So next time we'll need to talk about what we want. Well, we probably need to do that now. We need to decide what the maximum amount would be in statute, and then we can talk next time about what it would be in reg, the actual fee we would charge.
How much are like the licensure fees in this, Leslie, off the top of my head? Because I would assume this would be much, much less than that.
Hold on, and I have them. I'll get it up.
Oh, I'm sorry. You know everything off the top of your head. I'm just. That's
the walking encyclopedia of BSRB statutes and regs. I was thinking.
She's my research.
Yeah, I was thinking $50 off the top of my head.
Applications are not to exceed $150. Original license $175. Renewal $175. Replacement of a license like the wall certificate is $20. I don't know, $50.
That's what I was thinking.
Yeah, and that's just the maximum amount that you're putting in a statute. It's not what you have to charge.
Right.
That sounds reasonable, $50.
And that is just a one-time fee, correct?
Correct.
Yes.
And again, it wouldn't be necessarily $50. We could set it at 25, 20, or 10 or 15, whatever we wanted.
Right.
But this doesn't ever expire like a license did. They just have to do their continuing education. I mean, if they don't do their continuing education, is there some mechanism to say they can't supervise?
Oh, Jan, now you're opening up.
It's something to think. What are you going to do? They don't do their continuing education, but they keep supervising. You don't have anything to cover that.
We don't. I guess you could file a complaint against them.
Well,
We
yeah,
could-
but you don't have anything in your discipline statute to say that they haven't done their, do you have something in the discipline statute to revoke them or suspend them until they do CEU for supervision? If they've done all of their other CEU to get their license renewed? I'm trying to play devil's advocate here. I don't want Jane getting mad at us because she can't do anything when they don't do their CEUs. I think that's the other loop that we need to close in this.
I mean,
Then we have to open up the refuse to renew, et cetera, statute.
Well, I suppose if this isn't, if that wouldn't really, I'm trying to think, are you going to suspend their entire license or just the supervision? If it's just the supervision part, you might be able to throw something in this statute rather than your discipline statute.
I have a question about renewal since this has been going on for a while. So what have we been doing with folks? I mean, we're not auditing everyone. We're not
Right.
requiring them to submit anything, correct?
Correct.
So
We have,
you have no accountability that people are actually doing this now.
That's kind of to me the issue. If they're not having to do a renewal application and verifying that, yes, you know, I have done all my CEUs for supervision, I don't know how you know. People could not be doing this and still supervising. I think that's a piece of your puzzle. We got to kind of figure out what we're going to do with it.
Or eliminate it.
Yeah, I mean, there's no point in CEUs if you can't audit it and do something if they don't do it.
I agree.
That's true.
no, it should be, and I thought it should be in the CEU form when you renew a license.
So it would be in the license renewal. Does that cover the supervision CEUs as well?
No, it would just say, as part of your continuing education, did you do 3 hours on supervisor training or whatever? But it's not in there.
Because we would need some way that they have to affirm that they've done the CEUs to continue on as a supervisor, and maybe do that in the application for renewal of just their license. And then you could audit them for the supervision hours, I guess. But then how do you, I guess then that would be making, the people from the CRC maybe can answer this question. So if someone says, yes, I did all of my continuing education for supervision, and then you audit them and find out they haven't, typically, like say just a regular license, when they do that, what do you do? Or you're coming back and taking some kind of discipline against them, aren't you? Or giving them a warning letter or something?
Yes.
So it'd be the same. If we can cover it that way, that would probably work.
So okay, in the renewal, on the renewal form, the CEU form, it says, did you do 3 hours of ethics, 6 hours of diagnosis and treatment? Wouldn't the supervisor training just be part of the normal audit?
I think you need to ask them that question. If you are a supervisor, have you also done the CEUs that are specific for supervision?
Right.
So that they have to answer that as well. And then that would be how you would hook them in if they hadn't actually done the one specifically for supervision. So I don't know if your renewal applications have that question or not. If not, we need to change that.
No, I'll make sure it's put on there. But my question is, would we specifically audit only the supervisors, or would that just be part of our normal audit? Because we ask the question, and then when they send in audits, they would send in all their certificates.
Well, if your audits are random, I mean, you'd have the possibility no supervisor would be audited. So I think you probably need to be auditing specifically the supervisors. I mean, it could be a random audit. You wouldn't have to maybe audit all of them, but a random one's just for supervisors.
Okay.
So if I heard it correctly, you're not
put the violation in the CEU statute, or are you going to put the violation in the in the supervisor statute?
No, I think the way, that's what I was asking. I think the way the CRC does it now is if they answer, yes, I've done all of my continuing education, and the audit discovers that they have not done it, then the CRC does take action. They may do.
We do it in the statute for,
probably what they go after is not that they didn't do their continuing education, but they made a misrepresentation on their application.
Yeah. This is Cindy. Yeah, we do it under 7 or 8 of the statute for misrepresentation.
That's what I thought. It'd be a misrepresentation on the application form that they did all their CEUs when they had not.
Yes.
You're not actually talking about a renewal of the board approved supervisor. You would embed it or incorporate it into a regular license renewal.
Correct.
Yes.
And that way we don't have to create new language in the statutes. And we'd be handling it just like what we do for any license, even if they don't do supervision.
I'm texting Misty now to tell her.
Okay. Other questions about adding the statute requirement for board approved clinical supervision training to our board packet for this session? So the changes as proposed would be, of course, we need to open up the fee statute on all and add the $50. We need to add quarter hours. Did I miss anything? Oh, it was a form by the board. That was the other one, sorry. Never mind. Okay. Guess I'm ready for a motion to approve the addition of this to our legislative packet with the changes discussed.
This is Andrea, so moved.
Do I have a second?
Carolyn, I second it.
Any further discussion? Questions? All in favor, say aye.
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 Aye. Is there any opposed?
Voting opposed just for the reasons I stated before. I understand the reason and rationale. It just doesn't make sense to me to create a regulation before you have a well-defined plan for what it is you're trying to accomplish and how you're going to do that.
The statutory language is what we would call enabling language, allows us to create this approval. The regulations in general lead to the specificity to actually enact the legislation. But otherwise, I don't really disagree. All right, any other opposed that we want to get down for the record? Or abstaining?
I would like to abstain. My apologies. My internet connection has been going in and out, and so I missed the latter part of the conversation.
Okay. I'm assuming we still have majority with two, with one of yeah, we're fine. Okay. All righty, very good work. Moving on, back to the agenda. New business. All right, so this is the part we can take a breath. These are just some things that have come up this year that we want to talk about going forward. They don't have, at least as far as I know. Well, that's not true. Clinical supervision, these are regs though, right?
Yes,
Except provider disclosure is in both.
yes.
All right.
D actually should have been up in old business, but
Yeah, you're right. Okay, scratch what I said. We're going to keep our current thinking caps on for another topic that we should have. This is a follow-up item from at least one meeting, maybe two. And there is a document in, so just to recap, we've had lots of discussions in our advisory committee meetings about how often clinical supervision is to occur. The way it is currently written is confusing. And so that's led everyone to kind of dissect this and rethink, well, what is it we really want? And of course, the age-old debate between the minimum and what we would like to see happen, and trying to find the balance there. So there is a document in your packet, basically, that Leslie has put together. And I believe there's two documents that are identical on how I can make it out. So it doesn't matter which one you pull up.
find another one. The third sentence should be taken out.
Can you read it, please?
Supervision must occur at least 2 times a month, regardless of client contact.
So the next sentence was actually the way you wanted it.
Right.
Right. So the other one's not necessary. Okay.
Right.
So it would read, meet at least 1 hour every week in which client contact has occurred. Supervision sessions must be at least 1/2 hour in length. Supervision must occur every other week, regardless of client contact. 1 hour is defined as 50 minutes. 1/2 hour is defined as 25 minutes. So what we tried to do was kind of blend together the intention of lots of the different committees in hopes that we would find one common definition. I do think that that's an important thing to try to accomplish here.
So in looking at how this language comes together, let's say you have one of those slow burners who have very minimal client contact, and they see one client every week, and maybe they only have 5 to 10 client hours a week. You still see them twice a month, thinking about like our current process. Twice a month, 2 separate contacts, one's individual, but that would make this regulation or this language change would say, regardless, we have to meet weekly.
I think you're hitting the nail on the head.
I'm interpreting that correctly, right? That's what this.
You are, and it's very difficult to write very specific language for what, 95% of situations. So not easy. So we can talk about potential word changes.
This is Janet. I have kind of a question because we had regulations that had similar language, and remember we had, well, I'm sorry, new board members won't remember this, but what was happening is they would meet 10 minutes and 15 minutes in that time. And then they would try to say, well, when you add those all up, it comes to 1 hour. And so I think it needs to say, perhaps, I'm trying to think of what the wording would be, but 1 uninterrupted hour. So that way they can't try and do it by minutes and then add it up and say, well, in that week, we did meet for a total of 1 hour.
That was the intent of sentence number 2, Jan, but maybe it needs to say each supervision session must be at least. That was the intent of number 2.
I think the word was continuous.
Yes.
continuous hours.
Yeah. Either way, I think
Fine with that
it makes
too.
it a little clearer.
But it would allow 2 half-hour sessions in a week rather than 1 hour.
Correct.
So yeah, if you made it at the half hour, must be at least 1/2 continuous, somehow continuous.
Yeah,
And then that way, when you say to at least, then that way, if they want to break it up into 2 1/2 hours, they can, but they've got to have at least that 1/2 hour to be able to add it together.
Kind of along Mary's comments, what does the board think about amending the first sentence to say meet at least 1/2 hour every week in which client contact has occurred?
Then do you run into the other problem where you have somebody who's got 20 client contact hours, but this says they only really need to meet with their supervisor for a half hour?
Which is why we have ratios right now, which has been problematic too.
I was
I'd
going to
rather
say, the
err on
ratio,
too much than not enough.
the ratios, they do what they want throughout the time, and then they say, well, when you add it all up, it's 1 to 20 or 1 to 15.
And I kind of think you could probably do the same thing here with the way this is written.
What do you mean, Jan?
Well, supervision session must be at least, maybe say each supervision session.
Mm-hmm. Yeah, I like that.
And someone had the word continuous in there, but I wasn't sure exactly where, but it seemed like that was
Yeah.
important.
And that's
I have a question, Jan. So if you say supervision sessions must be at least a half hour, doesn't that say it has to be continuous?
well, that's why I'm thinking, well, yeah, it probably would work. Either that, or I think maybe just each supervision session must be, so that,
Right.
yeah.
I mean, I'll add continuous. I don't care. I just,
I continuous to me makes it kind of clunky trying to throw it in there. And that's
Right.
why I kind of thought maybe the better option was what someone else suggested would be each supervision session. I can't talk. Each supervision session must be at least 1/2 hour in length. I think, don't you think that would make it so they clear then that they can't do anything? I mean, they could do something in less than a half hour, but it's not going to be counted.
right. That's what we were going for.
Yeah. I know. I am trying to get a way around, make sure someone doesn't get creative to come up with some argument.
Some of the things that you come up with are just kind of amazing to me. I would have never thought of it.
Well, since we're kind of slicing and dicing words here, as their thought around is the week generally understood as what every other week would be? I mean, it's got a Wednesday to Wednesday, if that fits. Is that a Sunday to, I just, again, I'm just thinking practical real world supervision, what we do out there and how we schedule with post grads and provide them the level of supervision we need.
You're
And
right.
there's a lot of variance in what happens, and it's really dependent on the, you know, kind of the number of hours, number of clients they're seeing. And so, and I think that happens a lot. There are people who are working towards clinical licensure at a very, very slow pace. So if the intent isn't to speed that up, the intent is to provide adequate oversight. But sometimes in doing that, we, you know, unintentionally create things we don't mean to create or intend to create.
That's something I guess the board would need to give us guidance on. Currently, obviously, we go by numbers, and most times when we request logs, there's something that we could ding them on. But to me, I mean, like you said, if you can meet on Tuesday and then you can meet on Monday or Thursday, you know, I wouldn't think that would be that big of a deal, just sometime during the week. But again, I don't provide supervision, so.
And that's what I'm trying to avoid. I'm trying to avoid something that unintentionally penalizes people for just what life occurrences. And even though you're meeting regularly, I certainly have heard the feedback about people who are putting all their supervision in the last 2 days of the month, or all of those scenarios that we don't want. But for those who are doing supervision, I mean, you know, you are scheduling as what works in busy professional work lives across, you know, across different people. So there are variables that happen, and you wouldn't want to exclude a whole week of someone's client contact if a log were pulled because of something that was unintentionally written.
Right. I would think that if the board said that, then that would be, I mean, if it's just within the week, then it's within the week. And this would say throughout the entirety of the training plan. So they'd have to do it, you know, the entire time.
Are you trying to distinguish between the week and a week? So the week is kind of calendar oriented, and a week is kind of has a start point that could be in the middle that would run to the middle of the following week.
And that's what I don't want to do, Dave, because, you know, if I schedule someone today on Monday, but I can't see them till next week, Friday, I mean, that's what I'm trying to avoid, because again, life happens for people, and everyone's working different jobs and all sorts of things. So I think you don't want to do something that's unintentionally excluding when the intent is there to meet and provide supervision.
Are you perhaps thinking rather than every week, every other week then, to give a little bit more flexibility?
That was the every other week that was in there, but now we're saying, you know, I guess I'm aware of a lot of post-grad supervision in the MFT world, and there are people who are really slow paced and some people are really high paced. And I'm still stuck on the every week that client contact could occur, because someone could have one client contact hour one week and 4 the next. Well, yeah, we're going to have 2 contacts, that kind of thing. But at this point, we're probably not meeting weekly. If they're that we're watching our ratios, because we've got the 1 to 15 and 2 contacts a month right now. So I'm just thinking, practically speaking, what you're really doing here is it's going to be a huge shift for, I'm sure, quite a few people.
Well, some disciplines did recommend every other. So we're starting with the strictest interpretation first, and then see what people are comfortable with.
Is this going to be, did you say in a statute or a regulation?
Reg.
That's, as I say, I wouldn't recommend putting it in a statute, because you may never get it changed if it works out that it needs to be tweaked.
Right. I mean,
So maybe we're not ready to finalize this today.
right.
Okay.
Does anyone have a sense of what other states require?
Well, depends. MFT, I know in Missouri is very, at least that when we went to speak with someone who was from Missouri at Friends, I believe, they said they have to meet 4 times, either once a week or 4 times a month with each supervisor they have. So if they have 2 supervisors, they have to meet 2 hours. Is that not correct?
No, I think that's correct. I'm just saying, yeah, it's so much. I'm shaking my head like, yes, that's way too much.
I was like, good grief, and they think we're bad. I don't know. You know, most places are an hour, I think. But I can, you know, we can kind of have someone go out and look at, you know, each state around us.
Yeah, I was just curious, given that we're not the only ones to struggle with this issue, whether somebody had come up with a formula that we might borrow.
Right. I think most people do not look at hours. It's a set time. But I'm happy to look and bring it back.
Okay. We're comfortable with tabling this till March. I give you some time to go back to your advisory committee meeting, show them this draft with the change that we made. And honestly, I think we're close. Because again, if you want to be more specific, this is just some of the kind of the medicine you got to take with it, right? I mean, you can't have it both ways. You're gonna loop in the bad actors. You got to tie their feet a little bit. Okay, so moving on. Education requirements, i.e. in residence. Remind me, Leslie, is this statute or reg?
Regulation.
Do you want to give some of the background on this?
Sure. We have had a lot more online degrees. The in residence is specific, in our regulation is specific to the institution. So someone has to meet on campus with core faculty for specific coursework, whether it's a type of coursework like testing and psychotherapy, or for counselors, it's just 30 graduate semester credit hours. And there have been more and more online schools, and not necessarily, fly-by-night schools. Fort Hayes is working on a psychology degree that has most of it online. Anyway, it's become more problematic. We're just getting more and more people, especially military, who have to go to online programs, and then they come home and they can't get a license. So the definition that is in this regulation, and I didn't highlight enough, is in all regulations. Yeah, addiction counselors is worded a little differently, but it was actually done in 2002. That was when the in residence was put into the regulations. And at the time, from what I saw, at least in like 2005, there were not very many online programs. The ones that were not very quality. And so it's just something that maybe the board can review and decide if this is still appropriate. Although Jan did say the fact that we say in residence and residence in an institution, in the university, has a totally different meaning. So that could be an issue that you may want to look at for language, but just if there's another way to show that it's a quality education besides saying it has to be on campus.
So to recap, as we already know, the world has shifted. Education has shifted. How education is delivered has shifted. Our foregone conclusions and judgments about not being able to get a quality education online has shifted. It seemed like this is an important discussion to have as we continue to look at barriers to licensure that have outlived their usefulness. If that's true for this, I don't know. Guess we'll figure that out.
I have a question about the highlighted section 11.
Yes.
And it says, and require that the practicum or internship be completed at the same institution.
Yes, this is for counselors. Deb just asked me to do one profession. So yes, that is actually most professions, that's the case.
Does that mean the practicum experience is on campus?
No, the practicum credit is from the same program as the 30 graduate hours and
Gotcha.
because a lot of, well, okay, from what I've been taught, and that if the practicum isn't part of the program and someone just goes to another school and does a practicum, that's probably not a very, quality type. Most universities won't allow someone to just come in and do a practicum.
Yeah, it's kind of a juggling act to be able to move with the times, but at the same time, make sure that the people are getting the quality education. You need to protect the public, because what we've seen is that some of these online things, it's, they don't have people that are actually a part of their faculty that are doing this. They go away for a weekend and someone comes in and does it. So I'm kind of wondering if what you've got highlighted about the core faculty member, I don't know as though that would be the problem. I think the problem would be in number 2, the definition of in residence, because that means a student has to be at the physical location of the institution and the face-to-face contact. So I think the issue is more in that physical location, that the student has to be at the institution, which doesn't allow for the online stuff. Is that correct, Leslie?
That's correct. There was a break, so I thought that it ended there, but yes, it's number 2.
Yeah, I think the critical language is a definition of in residence, and that would be probably where you would have to tweak it, would be making the student present at the institution. And we'd have to think of a way to work around that so that you maintain the quality, so they can't do these, come for a weekend and do your practicum, do your course at a weekend in a hotel, kind of thing, to ensure that you actually have the core faculty teaching it.
The term residence is in the statute then, is that correct?
No, it's here. It's right below what Leslie
No, I
has
know
highlighted.
here,
It's the
but I'm
regulation.
where is it referring to? Because all we're doing here is defining it.
Yeah, the in residence
So
is in your statute.
I don't think.
That's my question.
I was thinking in residence that there was a mention of in residence in the statute, and then that's why it's defined. Or is it defined because you have in residence in 11, so maybe that's why it's defined.
Yeah, I was gonna say, I think it's just in.
Yeah, it's because the regulation uses the term in residence.
So it's referencing it's at the reg.
So, I mean, yeah, you'd have to make those number 11 and then your definition of in residence all work together. Those are the things to concentrate. Those are the 2 areas to try and figure out how do you keep the quality but still allow online teaching.
And
So
I don't.
hypothetically.
Pardon me?
Go ahead.
I honestly don't know, like Walden and Capella both have KCREP accredited programs for counselors. One of them has an MFT accredited program, and one of them either has or is working toward a social work program. So I don't know what happens at those. They don't have a campus either, do they? I don't think they do.
But they may have a campus, but it's not like a campus where there's students coming to class.
Right. So I don't know, do they not have residents at all? Or do they go for weekends? Even for the accredited programs, I honestly don't know.
I don't know, because I think there's some, if I remember correctly, some of them will say, well, for some, I did have to go up. I think they go up for like an initiation thing, like for 6 weeks or something.
Right.
And but then that's it. Then all the coursework and their practicums and stuff are all on, either online, or if it's in person, it's at some hotel from speakers rather than faculty.
But if we kept all the initial language about faculty, then that should at least steer them in that direction, that it can't
I think
just have
that helps.
speakers.
Yeah.
I mean, as I read 11, that was intentionally written to preclude all online schools, period. That's why that's there. Because there was a
fair assessment
against all online schools.
I was there when they were writing them, and that is the intention.
Quality was much different.
So the simple answer is to strike just that term. 30, you could continue to say 30 had to be done at one institution, require that the practicum or internship be completed at the same institution.
Well, but do you want something though that because you want it to be done still like face to face, so that they still, if they're going to do it online, it has to be through video classes, rather than just delete it. We're going to have to tweak it so that it's like they can do it. The coursework can be done online, but it has to be where they are having face to face, interactive, real time classes. I'm trying to get away from some of the creativity that we may see coming in if we just delete it.
Yeah, I mean, you're right. That is part of the definition of two. So I'm fine with that.
This is Rick. If you strike the in residence, it absolutely will end up being courses. It will be courses that are offered that are non-synchronous. I've listened to 3 TED Talks and 2 lectures, and someone's called that an hour of a course. That's online, right? So I think if you're going to do this, you need to specify what is the quality. Does it have to be face-to-face? Do I have to have synchronous courses? Or can I just listen to whatever and get some credit?
Yeah, and I think it has to be the core faculty that's doing the online stuff that's face-to-face or whatever. So I don't think we want to delete it completely, but we need to tweak it perhaps.
Something I remember from MFT many years ago was that they had courses where they all joined. And I don't know the term for the school, but like by Zoom. So every student was present on the computer face to face, but they weren't at the institution.
It's something like what the meeting that you're holding now, that there is a certain time and place where everyone is present. It's face to face. They can see each other. It's interactive. All of that. I think if you could change the in residence to that way, that it's a core faculty member that's teaching it, and it's something like what we do when we have our board meetings, so that it's all, they can't just do it when it's convenient for them. They all have to be there at a set time and place, as if they were at a physical location. But it allows them to be online, but they're all there and present together and interacting. I think that gets us closer, but it takes out that physical location part.
Could we use the term synchronous? Because that is now becoming a big buzzword, I know, in my kids' high school and middle school education. I think that's something more people are familiar with. That might clear up that component.
But you can always define it too. I mean, use that term and define it so that people understand that it's everyone's there at the same time.
Do we have some consensus that the board would like to move in this direction with some guardrails? No, Rick?
I won't vote for it. I mean, the board can do what it wants, but I think this is going down a path that is really bad.
Because?
Do you know anyone who's happy with the online education that anyone's getting right now? I mean, we've had a year of this.
Well, personally, I wouldn't compare having to adjust on the fly with the opportunity to actually create meaningful curriculum. I mean, so I don't know that this year is a great judge of the quality that can occur. I mean, this same board has created opportunities for, video supervision, telephonic counseling. I mean, we've already made some headway in this arena. So that's all I'm saying.
And every time we have, it's with the stipulation that the quality isn't sacrificed too much. And we have always talked about, of course, face-to-face is better. That's been,
sure.
We have said that for a year now.
Well, and this isn't precluding face-to-face.
This
is only precluding that you have to be in the building, in a brick and mortar.
Okay.
Give them the option, it's in a building or it's this other way. You may also want to contact the universities to reach out to them to see if they feel that the quality could be met in, over the internet. I don't know how they would feel about that. I mean, they may be willing to jump on it and others may see that as a way, no, we don't want to do practicums that way. I don't know how many of Kansas universities are doing practicums online. Do you have, well, they're probably not because of the way the in-residence is written, correct?
Practicum, my understanding is practicum, wherever you go, you have a supervisor, so that person.
Yeah, I used the wrong term. Yeah.
But they may have a supervisor from the university that they meet, like by Zoom or otherwise.
I mean, that's happening now. Of course, we're in, a different state with COVID, but there are hybrid models happening every day between supervision and even coursework at a certain time, although we've definitely, to Rick's point, moved to more on ground at Friends University whenever possible.
And some of this, in terms of our service delivery, we're never going back.
No.
Because there will be a demand by people to say, I have to have services delivered that way, and particularly for people who live where I live, where the distance between where they are and where a provider is to be in the same building would be such that it would cause them not to get served. So for me, as the world shifts, then we have to shift, but certainly to Rick's point, doing so thoughtfully and ensuring quality is going to be foremost on our minds.
So Leslie, you said Fort Hays is planning a online curriculum.
Yes, they're doing the testing and psychotherapy courses have to be done in person. Of course, they have an institution, so, but they'll go with the rest, I believe, at least a lot of them online.
A hybrid might be something. Hybrid might be something to consider too, like Leslie said. I don't know. Some of them have to be in physical location, and some of them have to be on. Some of them may be online too.
Well, that's
how we have.
What would be the best mechanism for us, for the board, to gather data from the different universities on what might be working and what's not working?
What I was thinking about, Andrea, was we could invite them to come and talk to us about this very issue and get their thoughts about it.
I think that would be great, Deb.
I like that idea also.
To get board input next time to this topic.
To invite the universities to join the meeting.
To provide public comment regarding any move away from the in-residence requirement, any changes, or amendments. All right. Any other questions or comments on that? If we're ready to move on, the next item is provider disclosure statutes and regs. This is also in your packet. So this is old language. David, do you want to talk about this one?
Just, I'm not exactly sure how this got created, and again, with the shifting times and people's access to information, it seems like requiring people to talk about what it is that they don't do, particularly when we already hold them to a standard on scope of practice. And so we've created something where they have to indicate that they don't practice medicine or do surgery. I know maybe at that time it was confusing for consumers, but it seems like given where we are now and people's access to information, this may not be necessary anymore. And certainly nobody on our advisory committee felt like it protected anyone.
So just for clarification, the example listed in your packet, the referencing statute is back to licensed psychologists, the definitions. But Leslie, I assume this is the same basic language in all the disciplines? Or no? Or is it just those that?
Deb, Leslie's away for a second, but she should be back here shortly.
Okay, thank you. So we'll find out the answer to that in a minute, but
MFTs have
open
that
it up for discussion.
MFT have that disclosure. So this takes it then this step further of really clarifying. Essentially, you're saying that we don't prescribe medication, we're not doctors, that kind of thing.
Right. He's asking, is this necessary anymore?
If we're waiting for Leslie,
David, are you also asking?
Bathroom break?
She's the only one that gets a break, David.
Leslie's getting something from her office.
Okay. I was hoping we could push through to the end. If that's not accurate, somebody needs to let me know. So we know we have it in more than one discipline.
Yeah, and ours also includes supervisory, who oversees your work.
Meaning you have to disclose who the supervisor is? Is that what you're saying?
Yes.
Yeah. David, could you speak a little bit more to, is this just awkward, onerous?
Yeah, it's more of an administrative burden of figuring out how you do this, how you document it, and whether or not it continues to be necessary. I mean, it kind of sounds like it started with licensed psychologists because they would carry the term doctor, and then somehow got spread to everybody else.
I see master's level has the same language, master level psychologist.
Rick was probably showing up in scrubs and really confused people.
And professional counselors has it.
I'm trying to identify.
And social workers. So my guess is they all have it.
I think they all have it.
Yeah, that's what it looks like to me as well. Probably the behavior analysts don't, because that was kind of the way it was passed, was kind of a unique situation.
And they have horrible statutes.
Yeah, that's what I say. Chances are they don't have it.
Implementing way. What have you not looked at, Jan?
I'm trying to find it in addiction counselors.
I think for just the sake of argument, we can discuss it for one.
Addiction counselors has it as well, so it looks like it's across the board except for behavior analyst.
So I'm interested in some comments from the public members on this one.
Okay.
This is Jonna. I was just thinking about that as a person not in the profession, from the client sitting there. I think there's, from just John Smith who's coming to get treatment or whatever, they would not clearly understand, the background of particularly of the licensee that's serving them. I would think leaving this in a disclosure would probably be helpful for a client, but to understand fully, what background the person is that they're seeing and what they're capable of doing and not doing for them.
I agree. I think that, again, as representing the public here, I would think this would be helpful. I'm still learning what all of these mean as a relatively new board member. So I think that I know that some people, this is kind of like the terms of service on some of our electronic things. Do people really read all of them? I don't know if they do, but it's there, and I think that it would offer some sort of just a base level of protection for the relationship as it goes on.
Yeah, this is, if the board would like to revisit, I don't want to weigh on if the board should take action today on this topic, but should the board decide to look at this in the future, I would be happy to look into a little bit of the statutory background to see a little bit more of when this was put in and maybe pull some of the testimony from those hearings if that would be something the board would like. So.
From the history of this psychologist, it was in 1999 and then amended in 2000. So you're talking 20 years old. No, it hasn't been looked at. Question for the licensees, this disclosure, do you give it to them in writing?
We do at Johnson County Mental Health.
Yeah, because it just says documentation shall be made in the record. So I'm just wondering if you do it verbally and make a notation in the record, or do you hand them something and have them sign it and give them a copy to take home? Because I kind of see it as being something that the licensee would use in case there's a question as to how they represented themselves, so that it doesn't become a lying contest.
Yes, we at an agency level, we do both. We have it in the client rights and responsibilities, as well as that's part of the required documentation when you see a new client. And then from students at university, it's a written form that has to be signed and put in the record.
Okay, so for the interest of time, because this is a brand new topic, I'm going to take David up on his offer to do a little research and put it on the agenda for March and see if we're ready to take board action or not in March. Does that sound okay, David? Okay. Any other comments or questions from the board, or anything else you need to consider this for next time?
Sorry, Deb, were you talking to this David or the board member, David?
Sorry, yeah, you, David, yes. You can do your homework. Don't spend a ton of time on it, but see if you can find anything.
Okay, I'll try to gather what information I can in terms of the statutory history and some of the testimony if I can locate it.
Great, thank you. Okay, unless I've messed up, I believe we are at the end. There's roles of advisory committee members. There subsequently has been discussion about Jan doing a full board and advisory committee member training. So I have two thoughts on that. One, if any of the current board members have any questions about advisory committees or members or roles or process that they would like to ask now, I can open that up. And two, well, I'll just leave it there right now. Does anyone that chairs a committee have any, well, it doesn't have to be, it could be anybody.
I think the training
roles.
I think the training would be great. We've got a few new folks on our committee, and I think that would be helpful.
Okay.
This is Carolyn. I know that when I joined the CRC committee, they had a kind of a day training before. It's very, very helpful for new members. So I support that training.
Okay. I think it's a good idea. I do have a question about the extent of email communication. Is that similar to official board email communication with advisory committees so that there can't be discussion back and forth, but really just here's the meeting date, et cetera?
Yes.
Yes, there's no difference between being on the advisory committee or the board. It's COMA applies to the advisory committees as well. I mean, you can send something informational, but as long as that's all it is, it's just FYI that there is no emails then that start going back and forth that comment on it or anything. That's all. Yeah, the better practice is just not to do the emails at all so that there isn't some kind of an issue that could arise later on that.
And Jan, this is Andrea. Is it okay for the co-chairs to send emails out to the advisory committee of upcoming board, committee meetings, or is that something that has to be done by the BSRB staff?
I think you're going to want to make sure the staff knows about that so that if they have to do anything to be prepared. But any subordinate group is going to be under open meetings. To give out dates and times of meetings, that is not necessarily like an interactive communication about the business of the board. That's sort of like a very small exception where you can say, give me the dates and times that you're available for a meeting, and then to say, here's the date and time of the meeting. That's, if you think of that as an exception, okay.
Yeah.
But
so we can
keep it to
go out
that.
from the chair and co-chair. What kind of the good practice is just, it's what I've always done. The staff, a couple of staff are looped into my email distribution. They're just part of my group. So they're always going to be part of any communication that I send out about whatever to do with the meeting.
That's going to be covered in the training.
And anything you send out to the committee is a public record.
Correct. All those emails are public record. That's why you need to loop in Leslie or David so that it goes on the state server. Again, we're going to go over this in training once we do it.
Yeah.
And I don't know how the advisory committee chairs feel. I mean, we can have one great big meeting where we do board members and include all the advisory committees. Or if we do it board and each advisory committee, it means you'd all have to listen to it twice. So.
If the content is the same, I wouldn't have any objection to having it together.
You could probably shorten it for advisory committees because there's some things they just can't do. But for the most of it, I mean, like they help us write regulations or draft the regulations or usually take the initial stab at it. So they need training on the authority of what they can do and how regulations are done. They are also under the Tort Claims Act. I mean, there's a bunch of acts that go beyond your practice act that people need to be aware of when they're really acting on behalf of the board. So a difference in probably is not going to be a lot of a difference between the advisory committees and the board. And to do a full-blown training, I really would like to probably have an hour time. And even in that can be kind of whirlwind because you're just touching upon the various acts and the highlights of it.
I would suggest scheduling an hour and a half so that we can have some dialogue if need be.
Do you want to do the March meeting?
I mean, if we're going to include the other advisory committee members, it feels like we should probably.
If we're going, I mean, the other option would be, because you have a board member on every advisory committee. So consequently, if we go to each advisory committee, then we should catch all the board members, correct? So maybe we wouldn't need one at the board meeting. Is that another option?
That way, do the full training at each advisory committee meeting coming up.
Yeah, then board members aren't subjected twice. Unless you sit on two committees.
Good. That works for me.
Just a bit more time consuming for me or Lainey, but you know, we'll work that out.
Okay.
The public members can gracefully bow out of the second advisory committee meeting. Because they're each on.
Once you've gone through one, yeah, I think when if you've gone to one of them, that should suffice, unless you just want to make it really stick.
So those of you that have standing times and dates, or you know the February, then I would say staff can just get those dates and times to Jan coming up, and you can see if those dates and times will work for you.
Yeah, and then we'd have everyone trained, hopefully maybe by the March meeting.
Yeah. The only comment that I wanted to make is just for board members to remember and to help kind of coach your committees that while they're there representing perhaps an area, a university, a provider type, whatever, a certain part of the state, that they really need to be mindful of certainly advocating for those things, but that their hat should really be for the greater good, not for just, you know, espousing what's going to be best for their agency or hat that they're wearing.
And again, that's pretty much how my training's going to, it always starts out as, so.
Okay. All right. That concludes our agenda.
Deb, do you mind if I speak to one just little item for the agency?
Sure, go ahead.
Okay, so as I mentioned previously in my report, the legislative session is beginning. There is one item I wanted to just talk briefly to the board about, and that is that there's probably going to be a number of bill hearings that are going to touch upon topics that have some relation to the work of the agency. And I believe it is very likely that individuals either in those meetings or outside of those meetings are going to reach out to me to ask, would the board be in support of this? Would the board be opposed to this? What is the board's feeling on this item in particular? And some of those might be in bills that are formally drafted. Some of them might be conceptual ideas. Some of these might be things that are constantly changing because of amendments and other things. I just wanted to bring it up here in the meeting to kind of get an impression from the board in terms of how you would like me to handle those. If there are specific bills, you know, I can definitely bring those to you. But since it's likely there might be a number of these topics, I wanted to do my best to represent the conversations that have occurred in board meetings, but not misrepresent any position the board has taken or has not taken. So I just wanted to bring it up here just to seek a little direction, sort of as a big picture idea going forward over the next few months.
So you want some direction to cover about 90% of communications that are going to happen?
Well, if you would like me, I can go ahead and,
I'm just teasing you, David.
if there are other bills, potentially I could bring it to the board to see if you wanted to have a special meeting specifically focused on one piece of legislation. But there's probably going to be a lot of these things that people are going to be asking me specifically, would the board be in support of this? And so I just wanted to ask for your direction. So.
Well, off the top of my head, I would say that you're certainly at liberty to talk about anything we've talked about in open meeting, that there's been discussions that or things we've already agreed to, right? Board action that we've already taken that might be similar. But of course, the standing answer is until we've had a board meeting, we don't know what our decision would be on any given legislation. I'm glad you brought up the session, because for folks that may be semi-new, the odds of you having to call us to a special board meeting is probably fairly high this session. And so generally we would try to schedule those at 7 or 7:30 in the morning, because I'm telling you that we don't usually have a lot of lead time. And that's about the best we can do to get everyone, or the majority anyway, in one place at one time. So, or noon, that's sometimes another option. So be kind of ready. That can very well happen. I can tell you in all my time on the board, the number of things that the legislature is entertaining kind of on their own about our laws and regulations has picked up dramatically. And I do not see that stopping. I think it's going to continue. And what we've already experienced is that sometimes they can create sweeping legislation that we may not agree with. So we have to be ready to weigh in quickly about certain matters. It's one of the reasons why I continue to try to push us a little bit, because I'd rather us be in front of things and at least have had some preliminary discussions on things that are difficult, rather than waiting till 7 a.m. you're barely awake and there's some bill we have to react to or challenge in some way. So it's not always the most preferable way of entertaining these things, but it does happen. So does that give you enough, David?
I believe so. And I wanted you to let you know as well. So my background as an attorney, it is possible that I might be exposed, some people might disclose things that are questionable in terms of if they're confidential or not when I hear them. I'm going to do my best to use what knowledge I have and what training I have, that if there is something official, but I feel confident that it is something that has been publicly disclosed, I will definitely bring that to you all. If there's something that is potentially confidential, or, I learned of some information that is not, public in a way that's very clear, I will go ahead and just use the information from the board meetings, information that the board has publicly taken in terms of their approaches. But I just kind of wanted to let you know, because sometimes that's kind of a tricky situation and a tricky line. If there's things that the board hasn't specifically weighed in, but I will do my best to limit it to positions the board has taken. And if something is publicly available, I'll do my best to distribute that to you so you can weigh in on the physical document.
Thank you. Anything else? Do I have a motion to adjourn?
So moved.
Second?
I second it. It's Carolyn.
All in favor, say aye.
Aye.
Any opposed? All right, let's reconvene at 12:30 for CAPA. That's a separate link that you should have received. That work for everyone?
Yes, it does.
Okay, thank you.
Thanks.